Welcome, future doctors, to another episode of the Future Minority Doctor podcast with Dr. Sulma
and Marina, where we bring you conversations to empower and inspire you to contribute to your community and the world by becoming a doctor.
Hello, everyone, and thanks once again for joining us. Today, we're going to talk about ADHD and if it's still possible to be a doctor. And I know this is a topic that is sometimes hard for people to open up and talk about, but we just wanted to make it transparent and really focus on a topic that is important to so many, just because Dr. Marina and I see it a lot, right? So believe it or not, a lot of people actually have ADHD. Some people have actually been diagnosed, but there are a lot of people out there that have it but never been evaluated for it. People can go their entire lives with ADHD without knowing it. And as you guys all know, Dr. Marina and I are pediatricians, so we commonly see this in our practice. And the thing is, when we do diagnose a patient with ADHD, there's a lot of feelings involved with it, I think, from the child or teenager and also from the parents. Sometimes they think this diagnosis might be a barrier for them to achieving their dreams or going to college or whatever it might be. Or sometimes they just feel bad about the diagnosis. I don't know, Dr. Marina, how has this experience been for you when you actually diagnose a patient with ADHD?
I would say it's highly variable. So some kids, from the time they're like 2 or 3 years old, their parents can tell that there is something just different about them. They can never stay still. They can't even sit at the dinner table long enough to like eat a whole meal. They're just like bouncing off the walls, that kind of thing. So sometimes I see kids that are pretty young. We do hesitate to make a diagnosis in really young kids. We wait until they're in school age, so kindergarten or first grade, until we have information not just about how they're doing at home, but how they're also doing in a school setting to make sure that we're making the right diagnosis. But sometimes, we do make it at a very young age, and kids particularly need help when it comes to school. Because if they're really active at home, that's one thing. Maybe they drive their parents a little crazy, but it's okay. Like, it's not like it's interfering with anything really major. But if they're hyperactive in school, then that can be really hard, because the teacher will start, complaining to the parents, hey, they don't stay in their seat. They're disrupting class. They're disrupting other kids. They're not learning well. And that can start to affect their academic performance and their academic success as well. So there are those kids that get detected young. But then there's also another cohort of kids that I see who don't get detected really until they're later in their school. So maybe middle school or high school, when all of a sudden you don't just have one classroom and one teacher to worry about, but you suddenly have multiple classes and multiple teachers, and you have to keep track of all of the assignments from all of the different classes. And that's when the demands of schooling can exceed your capacity to deal with those demands. And that's when you can start to struggle in school. Your grades can start to drop. You can start to have other challenges. And that's when sometimes the teachers start noticing and the parents start noticing. Yeah. And I will say one more thing too. Girls tend to go undetected more often than boys with ADHD, because not every person with ADHD has hyperactivity. There's sort of two types, which you'll probably go into, right? And so girls tend to be more of the daydreamers, where they're not being disruptive, but they're at their desk, they're sitting quietly, but they're not paying attention. They're just kind of off in their own world thinking about their own things. And they're not learning because they're not focusing. So those are sort of the subtypes of ADHD that I see in my clinic. And it can be really helpful, regardless of what stage they're at, to have this diagnosis, because it helps a child and a parent to understand what's going on and be able to help them work on their unique strengths and their unique weaknesses and connect them to the appropriate resources.
Exactly. So just like Dr. Marina said, so ADHD involves having issues with attention or hyperactivity or both. And they can manifest very differently depending on age, on sex, just female versus male, and then also even in adults. Like, so if you're in high school or you're already in college as well. And there's very varied presentations also will further vary, because you can have mild, moderate, or severe symptoms as well. So it could just present very, very differently. But If you're listening today, maybe you have ADHD or you're thinking about it. So, how would you know? Right. So, maybe you have issues with attention, remaining focused on a task, time management. You might have impulsivity, which could look like you react without thinking the consequences thoroughly. The hyperactivity with children is different than adults. With adults, it might be more like restlessness, or you talk excessively, or you interrupt others before they're finished with their conversation that they're having. And then you can also see emotional dysregulation. Like, for example, you're irritable, you have these anger outbursts, or low frustration tolerance, and then also motivational deficits as well. So, those are some of the key features that if you consistently have might bring up to attention or red flags that maybe you might be struggling with ADHD. But
Mhm.
when should you be concerned about it? Like actually do something. So, of course, like everything I mentioned, some of us will have these traits at certain points of our life. And that doesn't mean that you have ADHD. Okay. I've procrastinated before, right? And I know Dr. Rena can relate to some of those as well.
Uh-huh.
It doesn't mean that you have ADHD. So it's sometimes hard to differentiate whether you truly have it or not. I, as a doctor, usually become concerned when ADHD starts impacting your daily function of life and the symptoms are persistent. Okay. So we actually use a code through the DSM-5. And what that stands for is Diagnostic and Statistical Manual of Mental Disorder. So this is what doctors, psychiatrists, psychologists use to kind of gear down who really has ADHD. And their criteria is a persistent pattern of inattention or hyperactivity and impulsivity that interferes with daily functioning. And your daily functioning could be in the social arena, academically. That's usually what we see in children, but with adults, it might not always be academically. It could be socially or even in your workplace as well. So these symptoms will show up in your workplace too once you're an adult. The symptoms have to be present for at least 6 months. If you're an adult, symptoms present prior to the age of 12 years old. And you want to see these symptoms in more than one setting. Okay. This is especially important for us when we see kids that the parents might say, at home, they're all over the place. They can't focus. They don't do anything. Yeah, if you talk to their teachers are like, this is like the greatest kid. He's totally fine. So I have to really differentiate like, wait, does this child really have ADHD or not? But the same goes for an
Mhm.
adult. It might be in certain settings that you display these behaviors, but not in others. So you want to see it present in more than one setting. Okay.
Mhm.
And like Dr. Marina alluded to, you can have the inattention type, you can have the hyperactive type, or you can have both. And there are specific, I won't go through them all, but there's specific symptoms for each, and you have to meet at least 6 of those to be able to be diagnosed as inattention hyperactive. Or if you have 6 in each category, then you have both. Okay. So, if you are consistently seeing issues with academic performance, problems in your relationships, problems at work, and so forth, it might be worth checking. Again, like I said, there are many other things or moments in your life where you'll have some of these symptoms, and sometimes it might not be ADHD. It could be something you're going through at that time in your life. It could be anxiety. It could be depression as well and many other psychiatric or medical diagnoses. But the best way to know is you have to be evaluated and really talking to a doctor, or psychiatrist, or psychologist. Anything else you want to
Mhm.
add to that, Dr. Marina?
I would just say that, the point you made earlier about it manifesting differently sometimes at
Mhm.
home versus at school, that we definitely rely on that to make sure it's a true diagnosis. The demands are different, at school versus at home, and parenting styles are very different at home or at school. So maybe a child lives in an environment at home where there's a lot of chaos. Maybe the parents, not by any fault of their own, but maybe they just don't know how to set boundaries with their kids or follow through with rules and things like that. And so that can lead to more chaos and more unpredictability at home. Whereas at school, sometimes then the child maybe has a really good teacher who has really good boundaries, really good rules, is consistent with following through. And so maybe that's why in school they're able to do better versus at home. So I would say the point is the environment really matters a lot. And a lot of studies show that trauma can have a lot to do with
Mhm.
the manifestation of ADHD symptoms. So some kids don't necessarily have a brain that's wired with just plain ADHD. It's actually been induced by trauma, by an unpredictable environment, by certain, emotional things that have happened in their life, by fear or other things that have happened that have triggered their nervous system to be on high alert all the time. And so they can't focus because their nervous system has been trained to always be worried or always be fearful or always be on the lookout for something, right? So ADHD is a little bit complex, but what you mentioned is right on. Like, these are the criteria that we look for when we're looking to make a diagnosis.
Yeah, and again, the settings also goes along if you're in adulthood. If you do have a history of trauma, it can show up even in adulthood and you just don't realize it as well, where it might not be ADHD, right? So
Mm-hmm.
if you work in a toxic environment, you might have these ADHD-like behaviors once you step into work, but when you're at home or in other settings, they're not present as well. So
Mm-hmm.
just to keep in mind as well from an adult perspective.
Yep.
So, what causes ADHD? That's a common question, right? That we get also when we're in the doctor's room. So, basically, it's just the way your brain is wired, and genetics does play a role into it. Your brain is wired in a way that the areas of your brain that help you with executive functioning and behavior are different, and the activity of the neurotransmitters or brain chemicals also just work differently, to keep it simple. The important thing,
Mm-hmm.
though, for you to remember is that it's not your fault. It's just the way your brain is. And the good news is that there's treatment and help. Okay. And why is it important to even talk about ADHD or even get treatment for it? So, ADHD actually has higher rates of occupational difficulties, so problems at work. It's also associated with increased criminal activity, substance use disorder. I think Dr. Marina and I can attest to this. We see this often with teenagers. It's also associated with traffic accidents and motor vehicle citations as well when you compare it to those without ADHD. There's also an increased risk of mortality because of these high risk behaviors as well. But of course, if you're listening today, it's important because we want you to be a doctor and you want to be a doctor. And we want to tell you that you can have ADHD and be a doctor as well. Okay.
Uh-huh.
And as far as with the treatments, so it's two components. One is medication and two is therapy, cognitive behavioral therapy. And we know through a lot of scientific evidence that when you do both, that's the most effective. And I think that's regardless of age, whether you're a child or whether you're an adult, both just seem to work better together. The medications that are used are stimulants such as amphetamine or methylphenidate. Those are usually the first line treatments. However, there are non stimulant medications too that can be used. And there's so many types of medications nowadays within these categories. So, for that, you'll need to talk to your doctor. They'll go through your history and really be able to give you the medication that will work best for you. There are side effects. We get asked that often. Usually they're very well tolerated. And then if one doesn't work, we change to another. But for the most part, we see more of a positive benefit than a risk to it as well. But again, your doctor can go through everything with you and choose what works best for you. And just so you know, usually what we do is we do a lot of check ins with our patients just to make sure they're tolerating it well, that we're seeing it's working, because that's the point of it, right? We want to see it, in our case with kids and teenagers, we want to see their grades improving as well, or they're not getting into too much trouble at school anymore. So,
Mm-hmm.
Dr. Marina, what do you think is your biggest challenge with starting patients on medication?
I think there are a lot of misconceptions about medications, and there's a lot of fear around medications, especially the stimulant medications. Now, these are derivatives of amphetamines. And so, of course, people think, like, I don't want my kid to be on an amphetamine. Like, that's a street drug. That's crazy. And it's going to be addictive and they're going to have side effects. Now, and then the methylphenidate preparations, they're also stimulants. They're not exactly amphetamines, but they're a related class of substances. So I think people just get really afraid of the possibility of their kid getting addicted to a medication or having a lot of side effects. But whenever you think about starting anyone on any medication, you always have to weigh the risks with the benefits, right? So if a child has severe ADHD, right, and they are failing classes at school, it's affecting their self-esteem because they're being told that they're dumb and they're having trouble having success and having trouble learning. And then they're more likely, studies have shown that kids with severe ADHD that go untreated are actually more likely to turn to drugs and alcohol and get addicted to those substances, drop out of school, have difficulty later in life. And so, so the risk of not starting a medication is all of those things, right? And the risk of starting a medication, we use very specific doses that are not addictive. If you take them for a long period of time, there are some people that have difficulty tapering off of them if they've taken them daily for years and years and years. But for the most part, they are not nearly as addictive as people think that they are. And the benefits of taking this medication can be improved academic success, improved self-esteem, decreased risk of school failure, dropping out, turning to drugs and alcohol as self-treatment, right? So you kind of have to weigh those risks and benefits. And the risks of medication are usually things like decreased appetite, maybe a bit of weight loss in some kids or some people who are more sensitive to that side effect. In the beginning, you can have things like increased heart rate or headaches that get triggered by the medication, but those generally tend to wear off after a few weeks. So I would say just the biggest challenge is helping parents and people to understand those risks and those benefits and trying to help them choose if this is worth it for their particular circumstance. And just allaying all of those fears, I would say, is a big challenge.
Yeah, a lot of parents actually just give the medication on school days, right? So
Yeah.
again, that's just so you know, like it doesn't mean you have to take it every single day of your life. It's really going to depend on your situation, just like Dr. Marina said. And if you think you have ADHD and you're in college right now and struggling, there's a chance that you just went through your entire life diagnosed. I remember I actually was still following him, and he was now in his first year of college, and finally went to go ask for help and came back and said, I think I have ADHD. And so we went through the whole process and we started it. And it was night and day for him once he got treatment for it. He said, I wish that I would have talked about this before when I was in high school, because I think I would have done much better academically, and even brought his brother who was struggling, who was younger, to an appointment. And then we went through it, and it just, again, genetics does play a role into it. And it's just nice to see. I have also, and I'm sure you've gotten this experience too, when you've diagnosed the kids, a lot of parents actually admit, I think I've struggled with that my entire life. And that's why I didn't graduate and I made poor decisions. I wish I would have. So I know that's a common theme, and I'm sure you get that from parents as well.
Yes, definitely. Yeah, just last year I diagnosed a teenage girl, and her mom realized after we had that whole process, oh my gosh, I think this is me also. And then she went and sought treatment, both therapy and medication for herself. And the teenage girl didn't really want medication. And we do encounter situations where people just are not open to the medication, and that's okay. It is not something you have to do. There are some other approaches you can take as well. It just really depends on the circumstance and the severity and someone's particular preference. I will say one more thing. I wanted to share this story about my office assistant, and she's wonderful. She's now in her mid 40s. And she told me the story of the fact that she was diagnosed with ADHD just a few years ago and started on medication. But she had struggled her whole life with symptoms of ADHD and never knew that she had it until a friend of hers mentioned something about caffeine helping her to sleep. And she said, oh, like when I have trouble sleeping, I drink caffeine and it puts me to sleep too. And she said, that could be a sign of ADHD, because for most people, caffeine is a stimulant and will keep you awake. But for some people, when your mind is constantly going, caffeine actually helps you to focus enough so you can fall asleep. So then that triggered her evaluation and her realization of her ADHD and treatment. But she talked to her parents after her diagnosis and found out that she had actually been diagnosed as a child. As a
Oh.
child, she was very disruptive in the classroom, very talkative, always like turning to the kids next to her and like chatting and like raising her hand and like just that kid that wouldn't like be quiet in class. And she had been diagnosed when she was young, but her dad was really, really opposed to the diagnosis and the label and treatment. So every time she would get in trouble in school or start being disruptive, he would just change her school. And so she ended up being changed schools like 12 times when she was young.
Oh,
And she
wow.
looks back at it and she says, I wish my parents had just accepted the diagnosis and put me on medication. Like, how much more could I have accomplished in my life? And my growing up years would have been so much easier, and I wouldn't have had to go through all those changes at school and all of that stuff. So she looks back and she's like, I wish my parents had just put me on medication when I was young, and I would have avoided so many challenges in my life. Right.
Yeah.
So as much, I try to kind of share those types of experiences with parents because I
Mhm.
want them to make the best decision for their child. Right. I don't want a kid to end up in a situation like she did.
Yeah, exactly. And I get a lot of those same stories from the parents. And if you're right now in college and relating to the story, then it's okay to go ask for help and really look into it. I think sometimes when you're an adult, and I would say the older teenagers, it brings clarity once they have the diagnosis because now they're like, oh, it makes sense. Oh, I get why this is so hard. It's not that I was a bad
Yeah.
kid or not
Uh-huh.
trying, but I was really trying, but this was hard for me. So
Yeah.
it's almost it's relieving to some of them is what I get as well. But again,
Mm-hmm.
everybody is different, but you should get help if you're considering that you might have ADHD. Now, say
Mm-hmm.
you are diagnosed with ADHD, then how are you going to succeed academically to become a doctor? Because we said you can be a doctor and have ADHD. I have friends who are doctors that have ADHD, and I also have friends that are in other professions that have ADHD and have been able to be successful in their own way as well. So
Mm-hmm.
here are some tips. So one is students or children, young adults and adults do better if they have a schedule. So structure is very important. So once you go when you're at home, parents can help, okay? But once you go off to college, then obviously your parents are not there. So things that you can do is set up an alarm at the same time every day. You might need two alarms to get you up so then you can get your day started. And then, given that you might have some attention issues or get distracted easily, you may want to put the alarm earlier so that way you can give yourself enough time in case you're running a little bit late. You also want to plan your meals ahead of time. You want to plan and write your study times. So, a calendar is going to be very important to keep and
Uh-huh.
reviewing it at least once a week. And you want to keep a routine bedtime. So, again, this is part of the structure, but sleep is especially important whether you have ADHD or not. If you don't have ADHD, you don't sleep, you're going to have ADHD like symptoms, right? So,
Mm-hmm.
if you have ADHD, it's even more important for you to sleep well and that you keep a routine as well. And then it's also helpful if you're already in college or beyond to keep a checklist since you might forget certain things that you have to do and put it somewhere visible, whether it's on a fridge, on a wall in your bedroom, bathroom, wherever it might be, that way you can constantly look at that checklist.
When it comes to schedule, I will absolutely reiterate the importance of a schedule, and not just a schedule, but like reminders on your phone. Nowadays, we have a
Mhm.
smartphone with us all the time, and those like alarms and reminders can be so, so helpful for a person with ADHD. So if you have ADHD, you might forget to take your medications all the
Mhm.
time. And if you set an alarm and you just make it a habit, as soon as I hear that alarm ring, there's no excuse. I just have to go do the thing. It's going to be so helpful. My husband has ADHD and he lives on his alarms. Like he just has them set at certain times to do certain things that he has to remember to do. Like we have chickens, and the chickens have to be put away and locked in their coop at a certain time, or else the raccoons can, come and get them. So he has his alarm, and he has 2 alarms, the first one and then the second one, so that he always remembers, because he's the one that's home at that time. So the alarms can be just magical. I have some ADHD traits. I don't have like full-blown ADHD, but I have some traits. And I used to miss doctor's appointments all of the time, because I would like write it down on my paper calendar and then I just wouldn't look at it. But now that I have alarms on my phone, and I have, every time I set an appointment that I have to go to like that, I set a reminder for one day before. That way my brain remembers one day before, and I'm like, okay, I have to get up early, or I have to do this to prepare for it. And then 1 hour before, my alarm goes off, so I have enough time to prepare myself to get to the place where I need to be. So alarms on your schedule can be life-changing.
I agree. I also use the Alexa for alarms as well. So that way, if I'm at
Uh-huh.
home, it's like, oh, I have to do this or I have to do that. I agree with you. I sometimes feel like I have some ADHD like traits as well. But again, not enough to like, it doesn't meet the DSM criteria. But there are
Yeah.
things I
Uh-huh.
do that are recommended for patients that have ADHD that I do to help me as
Mhm.
well. I tend to be that one that forgets where I leave my keys and my phone. So knowing that I have a place where I have to leave it every day. If not, forget about it. I'm not
Uh-huh.
going to find it. Okay. So
Yeah.
if you
Uh,
have something to do the following day, prepare the night before, have things ready to go, because you know you can get distracted as well. And then, as far as if you're a college student and when you're studying, you have to plan your study time. Okay. And then within the alarm system that Dr. Marina said, I would suggest you put in that alarm when you're going to have exams that are coming up, written paper. So that way you're not procrastinating in the last minute trying to do everything as well. So you can organize
mhm.
yourself. And then when you actually sit down to do your study time, now you're going to be easily distracted, right? Everybody is, but you're extra easily distracted. So I personally would suggest keeping your phone off, because you're going to be so tempted with every single alert that comes through that phone. Okay. So I would
Mhm.
definitely, and that impulse to want to go in there, that's what's hard to control with people who have ADHD. And then, as far as what you can do during your study time, because memorizing can be challenging, multimodal learning has been shown to help and work better for kids and young adults that are in college to study better. This might be highlighting your notes, using different colors, doodling while you're studying, recording the lecture so you can listen to them over and over again. Also, writing notes as you read, or even reading out loud might help things stick better. Standing up while you study instead of just sitting down or lying down, using mnemonics, and then especially having a study buddy. But again, just be careful that the study buddy is not distracting you more. So a good study
Uh-huh.
buddy would be one that holds you accountable, like, hey, come on, let's focus. We got to keep on studying to get through
Uh-huh.
it. Okay. And I think a big one is rewarding yourself. So, and this would be even daily. So, say if you have a plan where you're going to study for 3 hours, depending on what you do, if you break it up, whatever works for you, like look towards a reward after you're done studying, whether it's, oh, I get to watch this TV show or this episode that I've been wanting to watch, or I get to eat this, or whatever it might be. But I think it helps you and motivates you to stick through that plan that you have that day of. Okay. Because
Mhm.
delayed gratification could be hard if you have ADHD. So having little
Uh-huh.
rewards for yourself, I think, are good. The other important one that Dr. Marina always talk about is exercising. Helps get all that stress, jitters, all of that out. So keeping a good exercise routine daily will definitely help. And college is college. There's going to be drugs and alcohol. If you're already there, that's going to be present. So really avoiding it, just because there is an increased risk of becoming dependent, or actually liking how you feel when you take alcohol and drugs with ADHD. Okay, so we sometimes refer to it as self-medicating, right? So I'm really trying to avoid those environments, so then that way you can stay focused as well. And As we said earlier, taking your medication, having those reminders if you go off to college or medical school, whatever it might be, establishing care, whether it's with a doctor that's on campus or in the community. So that way you're making sure you're getting your refills and you're getting checked in and so forth. And then therapy if you need it as well. And say you do all this and you're still struggling academically, your college or medical school campus might have accommodations for ADHD that can offer extra support, like someone to take notes for you or extra time for exams. And this is usually done through the school's Office of Disability. Okay. So, anything else, Dr. Marina, that you think I have missed or that you would recommend for any pre-med students right now as they're studying to get good grades, studying for the MCAT, or even just getting ready to apply?
I will also just add that you mentioned that people with ADHD can sometimes turn towards substances like alcohol and drugs as a form of self-medicating. I definitely see that. And I wanted to mention in relation to that, that anxiety can happen quite frequently in people with ADHD, because if you think about it, if you struggle all the time with like remembering things or focusing, or maybe you're getting in trouble at work, for certain things that are outside of your control because they're just how your brain works, right? Then that can contribute to anxiety, right? Because of course you're going to always be worried, like, am I doing things right? Am I going to get in trouble? Am I going to forget something, right? And that's what anxiety is like excessive worry. And because of the way your brain struggles with certain things, you're going to be worried more of the time. And that just kind of becomes a vicious cycle in your life. And so getting treatment for anxiety, if that is affecting you because of your ADHD, is really, really important. I would say that I see people, especially teenagers and adults, struggle with ADHD and anxiety together quite frequently. So that's something else that you want to mention to your doctor or your therapist and work on coping strategies and things to help not just with the ADHD itself, but with the anxiety. That being said, like the more you treat your ADHD, the more your anxiety will go down, because once your brain is able to focus, once you're able to find more success in what you're doing, then that anxiety is not going to be there as much.
Yeah, and I agree. We tend to see a lot of psychiatric illnesses coexist too. So also, if you've always gotten in trouble or you've had problems with relationships, aside from the anxiety, then you can have depression. So I'm glad you brought it up. I do see patients that sometimes are on medications for both because of it. And it totally makes sense, just like Dr. Marina said. So thank you that you brought up that point as well.
Yeah. I'll also bring up one more thing. Some people who really don't want to do medications or maybe have like mild to moderate ADHD, they sometimes ask, like, what can I do for my child or for myself aside from medications, right? And there are some integrative approaches. So I'm an integrative pediatrician, so I tend to talk more about like diet and sleep and lifestyle and, toxins in our environment and stuff like that. And I want to mention some that a lot of people don't realize. So first of all, avoid artificial colors. So if you eat Skittles or M&Ms, or certain types of cereals, they have artificial dyes in them to give them those bright, wonderful colors. But those have been linked to increased symptoms of ADHD. So it's not like it's going to be night and day. It's not like, oh, if you stop eating artificial colors, you're not going to have ADHD. But if you eat a lot of that stuff, then it's going to increase your symptoms, right? It's going to just make things a little bit worse. And so if you want to help yourself, definitely avoiding those. Also avoiding pesticides. Studies have shown that pesticides also increase symptom severity in people with ADHD, especially children, because children are more prone to the effects of pesticides in the environment. Also, I read a recent study that showed that having like a more low carb breakfast can help to manage symptoms of ADHD throughout the day. So it doesn't have to be like low carb, but something that's like whole grains, like oatmeal, or like whole grain toast with peanut butter or eggs, instead of like a bagel or a donut or a sugary cereal. It's going to also help you to minimize your symptoms throughout the day.
All right. So I hope you guys learned something. And if you're thinking you might have ADHD or you've been diagnosed, Nothing to feel bad about. There's treatment and you can still be a doctor. We're hoping to get a friend, a doctor friend that can come on the show, and we'll have an episode where she can hopefully share with you guys what her experience has been like in her medical journey as well, which will hopefully be inspiring for all of you. Peace and love, everyone.
Take care.